Hello everyone, my name is Ali and this is PharmD School. In today's video, we will talk about the angiotensin II receptor blockers, also known as ARBs. Now, I've already made the videos about blood pressure medication, such as beta blockers and ACE inhibitors. I do recommend watching those two videos, especially the ACE inhibitors, because it will help you understand this video even better. So I will leave a link in the description below. Be sure to check it out, and if you do like those videos, please leave a like and subscribe to my channel. Now, let's get started. The first thing we're going to do today is understand how do ARBs work and what are ARBs. Now, this slide might seem confusing, but I will go in details in the next slide of how ARBs work and how do they prevent blood pressure from rising. Now, the first thing we need to know is that ARBs reduce the action of a hormone called angiotensin II. The hormone actually has a powerful constricting effect on the blood vessels, which increases your blood pressure. Now, angiotensin II also stimulates the salt and water retention in the body, and this is done by something called another hormone called aldosterone. And when you have more salt and water retention in your body, it further increases your blood pressure. So what ARBs do is they prevent or they block receptors that the hormone acts on. These receptors are known as AT1. And these receptors are found in the heart, blood vessels, and the kidneys. So when you block the action of angiotensin II, it helps reduce the blood pressure and also prevents damage to the heart and in the kidney as well. Now, we need to know a system known as RAS, also known as Renin, Angiotensinaldosterone system. So when your body has low blood pressure, your kidney releases renin, and along with the liver, it converts the angiotensin produced by your liver to angiotensin I. Now, angiotensin I is actually an inactive hormone, so it does not affect your heart or your blood vessels in any way. However, that is until the lungs comes into play. The lungs releases an enzyme known as angiotensin converting enzyme, and this enzyme also known as ACE, and it converts the angiotensin I to angiotensin II. And now angiotensin II is the active hormone that affects the heart and your blood vessels that will increase your blood pressure. What angiotensin II does is actually bind to a receptor type 1 and type 2. We will not focus on type 2 receptors. We will only focus on the type 1 receptors, because once angiotensin II binds to those receptors type 1, also known as AT1, it will vasoconstrict your blood vessels. It will release aldosterone hormone. So there are two ways of increasing your blood pressure. The first one is vasoconstriction. Angiotensin II will bind to this receptor found on your blood vessels, AT1, and it will constrict your blood vessels, causing an increase in your blood pressure. And it will also stimulate the body to release more of aldosterone hormone. And once again, the aldosterone hormone will have retention of salt and water in your body, which also increases your blood pressure. So what ARBs do is they actually prevent the angiotensin II from binding to the AT receptors type 1. So what ARBs do is they allow this whole system to work. That is until you have angiotensin II. And once you have angiotensin II, it will prevent it from binding to the receptors of AT1 that is found in the blood vessels and in the heart. Once you block the binding of angiotensin to the receptors, you will have vasodilation, meaning you will prevent vasoconstriction, your blood vessels will be dilated, which will lower your blood pressure. And you will lower the release of the aldosterone hormone, meaning you will have less of retention of salt and water in your body. That will also lower your blood pressure. So this is exactly what ARBs do, and this is how it affects your body to help you lower your blood pressure. Now, how do we know which one is an ARB medication and which one is not? Generally, the generic name ends with sartan. Some examples of really famous medications include losartan, and notice how it ends with sartan, valsartan, and olmesartan. Now, these three medications are really popular medications, and they are given to patients. Now, some general information you want to know is normally doctors generally they prescribe the ACE inhibitors at first. However, some patients they will complain of a cough side effects from the ACE inhibitors. So what doctors do is they try it prescribing the losartan, valsartan, or olmesartan, or any other ARBs medication they find to be effective, and they give it to the patient as an alternative of an ACE inhibitor. Now, this video is generally for education purposes only. I hope you learned something from my video, and I hope you watch my other videos as well about the ACE inhibitors and beta blockers. I will continue making videos about medications, and it can be any medication. So if you have any suggestions, please leave a comment suggesting what will be my next video. And thank you.